I just watched all the top videos for sciatica and none of them are talking about this one hack for instant relief. My name's Adam, and before I became a sports massage therapist, I had to deal with a lot of my own sciatica issues thanks to jumping out of planes in the Army. And I remember doing everything these videos show me, yet nothing worked. And that is until I did this one thing that not only helped me get instant relief, but help me stay out of pain for a very, very long time. But before I get there, you first have to learn what everybody's teaching you and why they're teaching it in the first place. Every single one of these videos, regardless of who's teaching it, is going to teach you something called a nerve floss. And the whole idea of a nerve floss is to basically help move the nerve through the tight muscle that's creating your pain in order to help alleviate it so it's not squeeze on it so hard. So here's the idea of it, right? Unlike muscles and connective tissue that has stretch to it, a nerve doesn't want to stretch. And that means we can actually manipulate it by pulling on the ends of it, which are located in the feet and in the head. This is why when you do your sciatica nerve flosses, they're telling you to move the head and move everything from the feet all the way to the legs, because we're basically just pulling one side or the other using the head or the feet. And of course, they're doing this for everything from moving just the ankle, just trying to get that little bit of movement, all the way to the knee moving, all the way to the leg moving in order to get that full nerve floss. But I've always been confused by this as well, because why wouldn't you just release the tight muscles creating that compression to begin with? I'm not 100% sure why most PTs are allergic to massage, but for some reason they all avoid doing it like it's the plague. That's why most of them will never recommend it, even though it is the right treatment for things like this. Just think about it for a second. All your pain is coming from some kind of compression on your nerves, whether it's in your lower back, in your glutes, in your hamstrings, or in your calves. And we could even get to the lower back in a second, but we'll get to the glutes down first. All these muscles are just getting overactive and tight for the most part, which then creates some kind of compression and tightness on the nerve itself. And that's why they're trying to make you move the nerve through these tight muscles when you can just address the tight muscles directly. And I know a lot of you are saying, well, sometimes the muscles are not shorn and tight, sometimes they're stretched out. Well, with that said, the muscle's stretched out for a reason, and that's because there's an agonist-antagonist relationship where the other one is shorn and tight. Let's take a look at the hamstrings. Most of them are going to be lengthened and tight, which means releasing them isn't going to do much. But if you release the quads or the hip flexors, that will actually help loosen up and help the muscle shorten, which therefore will help it decompress on the nerves. Now let's take a look at the piriformis, for example, right? If that one is chronically stretched out, that just means that the hips are stretched out by getting pulled into an internal rotation, which again, you can look at the internal-external relationship pattern in order to figure out which muscles are shorn and tight and the ones you need to massage out. Now, what about a herniated disc? Well, again, let's take a look at this from a shorn muscle, tight muscle perspective. If you have a herniated disc, some of the exercises you're going to be told to do are glute bridges and core training, like planks, for example. Well, if we take a look at the opposite relationships here, we have the lower back muscles, your lumbar erectors, and you have your hip flexors like the psoas. Your psoas muscle, believe it or not, actually attaches to your L3, 4, 5, I'm pretty sure maybe a few more there, but it mainly attaches to all the ones that's creating that compression on your nerves to begin with. And what's more is because it's getting short and tight, it may pull down on those vertebrae, which creates that compression in the first place. And then on the other side of that, you have the quadratus lumborum and the other erector muscles, the spinal erector muscles, that will also get short and tight, mainly the QLs, because they're the ones right next to the psoas as well, right next to the spine. So when those muscles get short and tight, the QL gets short and tight, they kind of work in this pattern, which then creates that other pattern of having a weak glute and a weak core. If you want to make this easier, your core is a lumbar flexor, Your QL is a lumbar extensor. There's your equal and opposite, your agonist, antagonist. Or your glutes are hip extensors, your psoas, and even your rectus femoris are hip flexors. So what does all of this pretty much mean? It means massage out the tight muscles creating the pain, or the opposite muscles that are supposedly creating your pain. So for example, if your hamstrings are supposedly tight, work on your quads. The whole idea here is if you're able to massage out the different muscles creating that compression in the first place, then the tightness will go away and that pain will most likely go away as well. So with that said, here is a simple list of muscles that you should be massaging for about 1 to 2 minutes each side, with the first one being your lower back. The goal here is to massage out each side for 1 to 2 minutes, which means a total of 2 to 4 minutes for your lower back in order to actually have some sort of change to the tissues. You can't just rub it out for 20 to 30 seconds and expect it to change. Just pretend like you're getting an actual massage here, like you just paid someone $120 to rub your back. You'll be pretty pissed off if they only rubbed it for 20 to 30 seconds as opposed to maybe 4 to 5 minutes. You gotta treat your tight muscles the same way how you would want a real massage therapist to work on you. So with that said, the first muscle is going to be your quadratus lumborum, your lower back muscles, with the second one being your psoas, the deep hip flexor muscle. Now, if you're not sure how to massage these out, then check out the videos in the description below. From there, you can then move into the hip flexors, which is pretty much your quads. And then you're gonna work on the glutes, including the piriformis, which is pretty much included anytime you work on the glutes themselves. From there, you can also work on the hamstrings for a little bit because yours may not be lengthened, they may actually be shortened. And then you massage out the calves along with the bottom of the foot. Altogether, there's roughly 7 areas you can massage for about 3 to 4 minutes, even though I said 2 earlier. But the idea here is if you just did 4 minutes on one side per muscle, you'll be done in about 30 minutes and you're gonna have that instant relief. And the best part is, after you're done doing this, go back and do all those nerve flosses your doctors taught you, because I guarantee that's gonna be a lot more effective.